Hello, this is Jeff Bellinger here for another 2 Minute on Tuesday. Don't know about you, but I'm tired of the snow. Hopefully spring is going to get here quickly. I think we've had enough snow over the past week. Here today to talk to you about tackling the high healthcare costs. It's definitely a concern with everybody out there, and we were just having lunch today, and I thought this would be a great topic. One of the ways you can certainly do that is by possibly looking at self-funding your ancillary benefits. And a lot of people don't realize they can self-fund the ancillary benefits. Sometimes they only hear about the medical, self-funding medical. You've certainly heard about that. You've heard about the new level-funded medical plans that are out there. Ancillary benefits, it certainly is a lot less intimidating than taking on your whole medical plan. Some of the common benefits that people will self-fund on the ancillary side are dental, short-term disability, and even some vision plans. You could do it correctly. Those three plans have relatively low risk in coordination with the premiums being paid. So it's certainly something that you could look at. You want to certainly make sure, though, that you are administering these right. So a lot of times employers won't take on the full responsibility of just self-funding them, internally within their office. They'll use a qualified third-party administrator to do it. Even one of the ways to do short-term disability, because sometimes it'll get tricky. Even though short-term disability is mostly used for maternity leave, sometimes it can be because of an injury. If it is because of an injury, sometimes as an employer you don't want to get into adjudicating if it's a qualified injury. So one way that we've done self-funding with short-term disability, if you don't want to self-insure the entire amount, is to buy a base plan from a party. Maybe you buy a $100 or $50, really low dollar amount base plan for everybody at the company, and then you roll it into self-insuring up to their correct wages. This way the insurance company gets involved as far as administering and adjudicating the expense, and then you just pay the overage expense, up to the salary amount that they would be qualified for. It can create quite a bit of savings. An example I could give you is, the dental plan for one of our clients that has around 400 employees eligible for their dental plan. Their premiums for the year would have been about $560,000. They came through at the end of the year with claims that totaled about $480,000, so it created about an $85,000 savings on their dental plan, even after paying the administrator the $4.50 monthly fee per employee for them to administer it, maybe make networks available to them. It still created a savings of about $54,000, so it's about a 10% savings. So if you are looking to save on some of these skyrocketing, benefit costs, might look into self-insuring some of your ancillary benefits. Reach out to us. We'd be happy to tell you some of the ways that it can be done. We've been doing it for quite some time on all three of those benefits, and we'd be happy to share with you some of our ideas. Hopefully the snow will go away. It doesn't look good, though. It looks like it's going to be cold for a while. Have a good week. Stay warm. Stay dry. See you next week.